You're watching Cetome TV. Knowledge is power. Melissa was wondering, is alkaline water or are alkaline foods a treatment for cancer?
Well, first off, I would like to know exactly what is alkaline water and what is alkaline foods. I mean, you're not going to drink a strong base, and that's alkaline, just like you wouldn't drink a strong acid. So I would say most water is around pH 7, roughly 6.8 pH 7. Definitely that's what it
On
is
a
in our
scale
hot
of
tub.
0 to 14.
Exactly,
So it's right in the middle.
exactly. So alkaline would be high pH, and acid would be low pH.
Okay.
And basically what pH stands for is per hydrogens. So when you have a variation either way, you get very caustic effects. So having water that would be alkaline or strongly alkaline is just not possible. I mean, you'd be drinking, that's like sodium hydroxide. You wouldn't be able to take that. It's like paint stripper.
Now, on that note, because there's so much misinformation out there. I mean, there's all these people spending so much money on these detox to change the alkalinity of their body.
You can thank Otto for that.
Otto?
Otto.
Who's
yes,
Otto?
He was a famous scientist that first came up with the concept of the different metabolic pathways involved in cancer cell. Cancer cells use different metabolic pathways as needed to recharge their ATP for their rapid cell growth. And some of those pathways have byproducts that can create an alkaline or strongly alkaline environment around the tumor cells. So there's the theory that tumors exist in that. Normal cells also exist in that.
Right. So it was misunderstanding
there was a concept based on the metabolism. And it's really been blown out of proportion. I mean, it was the acidic environment that the cancer cells create, and the concept is that the alkalinity or having an alkaline environment is what reduces that acidity.
Okay. That's the theory.
That's the theory, yes.
But what actually happens?
We have a system of buffers in our body that reduce and control pH, and they do it very, very well. And anytime there's any changes in any kind of environment in our cells, within our cells, or between our cells, in tumor microenvironments, our buffer system kicks into play and adapts and maintains it at a nice neutral pH.
So the fact is, it's not possible to change the pH of your body.
You can change the pH of your stomach, definitely, because your stomach is strongly acidic. About pH of 2 to 3, I believe. And, that definitely is the environment that favors acidity because you're breaking down foods. If you reduce the acidity of your stomach, you can start having digestive problems.
Oh,
and that's going to change. You can do it. You could take things like Pepto-Bismol, you could take acid blockers, you could do all kinds of things. But then what happens is you end up changing your biome in your intestines and your lower colon, and you could actually start getting nutritional deficits. For example, certain oils that are required for the mucous membranes are created and require that acidic environment in the stomach to maintain the biome that maintains these oils.
Right. So aside from being able to take certain foods or pills that modify the stomach acidity level or alkaline level of the stomach.
It's very temporary too.
Right, very temporary. So So back to is alkaline water or are alkaline foods a treatment for cancer? The answer would be no.
And there's no such thing as really.
There's no such thing. Right. Now that's not to say that certain types of foods aren't better for you or worse for you in terms of an overall health. We know that diet and exercise can be up to 80% of prevention of certain cancers. But that's not the same thing as this misunderstanding about alkaline things. So yes, the answer is no, Melissa. They are not a treatment for cancer. Thank you for watching Cetome TV. Subscribe below and stay informed.